So colposcopy is a specialized procedure. This is usually indicated for women with abnormal cells on the cervix following a smear test, or if they have any abnormal bleeding like postcoital bleeding or excessive discharge, or when the GP identifies that there is some abnormality in the cervix. It's a procedure that is carried out in the hospital with a machine called colposcope. It is a microscope where we could visualize the cervix with this advanced machine. Normally, naked eye can't see abnormal cells, so just having a speculum and looking with naked eye can't detect many abnormalities. With this advanced microscope, we will be able to identify abnormality. And the way the procedure is done is we ask to have a speculum examination. We insert a speculum and then we put a mild vinegar solution on the cervix, which will help us to delineate these abnormal cells. And we can look through the microscope to identify the grade of these abnormalities. Not all white cells, it is usually the abnormality is seen as whitish area on the cervix, but not all whitish area means abnormal cells. So sometimes to facilitate the diagnosis, we take some biopsies, which is just a pinch of skin. And that is usually done in the clinic where a consent is obtained and the procedure is explained. So the ideal candidates are those who are referred with abnormal cells on their smear, those who have clinical problems like if they have postcoital bleeding, intermenstrual bleeding, or if they have excessive vaginal discharge where a cause is not identified. Also, when routinely an examination is performed by the GP and they identify abnormality in the cervix, like they say ectropion, metaplasia, or any polyps, or any swollen glands, or any abnormality their GP is not happy about, they are referred to colposcopy. Colposcopy is very safe and it is usually, it's not painful. It's very similar to having a smear. We also recommend colposcopy in pregnancy if there are clinical indications and it doesn't affect the pregnancy, and hence it is the safest procedure. The procedure is usually very safe as it's just visualization of the cervix. Further, if we do a biopsy or if we do a loop excision, which is a treatment for the abnormality, then we discuss and a consent is obtained. And again, we want to make sure that it is the safest time in anyone's assessment when it is necessary. Sometimes over-treatment can lead to shortening of cervix, hence we always ensure we take into consideration someone's history, previous treatment, and their parity and their wishes to have further children before we consider treatment. So it is not a decision that is taken lightly prior to a treatment. And also, if a biopsy needs to be taken, it does not cause any risk or harm. Biopsies are safer. It is an additional test done to confirm the diagnosis or facilitate the diagnosis prior to any treatment or monitoring. So overall, colposcopy is a safe procedure. Taking a biopsy is still safer and it facilitates diagnosis as well as it helps to identify what is the right treatment pathway for any patient, whether monitoring or surveillance or treatment. And treatment itself is taken into consideration, quite looking into all the risk factors, and then a right treatment is provided to the patient after MDT discussion. So all the three things that we do following a colposcopy is a safest thing for when they are referred with any abnormality. The procedure normally takes around 10 to 15 minutes because we want to get you comfortable in a chair. Then we want to insert a speculum. Then we want to apply the acetic acid, which is the mild version of a vinegar. And then we look through the microscope. The microscope does not touch you. It stays away from you. And we look through the microscope. Then we take pictures for our documentation. So overall, the procedure takes roughly 10 to 15 minutes. However, During this procedure, you have the option to talk with your clinician, as well as we will be able to show you what we see through the microscope. So we always engage patients during this consultation. So you are able to see what we are able to see, and you are able to understand what we are going to discuss as treatment for you. So normally when a smear is taken in the GP surgery, it goes to the lab. The lab will be contacting you as well as your GP if there is an abnormality. When the letter comes, you have time to discuss the results with your GP. So you can always book an appointment with your GP to discuss what this abnormality is and what treatment would be offered. From colposcopy clinic, we normally send an invitation letter to you, and that includes the results of the smear. And when we see you in the clinic, what we expect you to think is read about what you're expected. A letter is sent to you as what the expectations are, how this examination is going to happen. Also, we expect you to make sure that you don't have heavy bleeding around that time. If you are expecting your periods, you can contact your GP so they can give you pills to delay your period. Heavy bleeding usually will hamper the assessment. However, mild bleeding is still okay. So if you are coming around the time when you will be heavily bleeding, we expect you to reschedule this appointment, where you could contact us and reschedule the appointment. Otherwise, there's no other contraindication. You prepare yourself for that appointment, and we will be able to support you through that journey by explaining what we find and how treatment is going to be offered.